Hello, this is Dr. Dave LaMond, the Medical Director for Blue Sky MD. I get asked a lot of questions about how we use hormones to assist with weight loss. And in other words, what's the relationship of hormone balance to successful weight outcomes or maintaining weight or losing weight? And the answer is pretty simple. As we age, every year that we age beyond our peak, call it in our 20s, we lose a little bit of the hormone called testosterone. And both men and women have testosterone. It's just men typically have about 10 times the amount of testosterone as women. And so regardless, as we age, you kind of have this downward slope that's gradually gets worse over the years. And so typically in the late 30s, early 40s, sometimes after certain life events, sometimes after pregnancy, your testosterone production doesn't click back on. So if you've had postpartum depression or suffer from migraines or trouble with female things like bleeding or excessive bleeding, these all might be symptoms along with weight gain that can give us a clue toward trouble with your hormones, which then therefore becomes problems with weight. And so sometimes it's hard to determine, what came first. But all that being said, when we do screen for patients, and we do so with a traditional, just basic lab testing that's easy to obtain, and we also check metabolism. And metabolism is a simple test that you breathe on a machine for a couple minutes, and it spits out a number and gives us an idea of how many calories that your body needs to maintain its current weight. And so taking those two pieces of information, so in other words, if your metabolism's a little bit lower than we might predict, alongside of your hormones, those levels may be a little bit lower than we might predict. That's a good formula for a patient that would be very successful with hormone optimization or replacement. And so we use bioidentical hormones. We use something called pellets. And the reason we use pellets is because they've been around, for decades, since the 1940s. So they have an incredible track record of safety. And it's the most efficient and effective way to replace testosterone. There's less side effects. It's more what we call bioavailable or available to your body. And so in doing so, and the last thing that I really like about it is it's very hands-off. It's kind of like filling up a gas tank, and your body really utilizes what it needs in real time. And it's extremely cost-effective. So in doing so, when we replace testosterone, what we're literally doing is giving the body its ability to preserve lean muscle mass. And once you're preserving lean muscle mass, so think about it like this, it's very logical. If you have more lean muscle, you burn more fuel, it improves your metabolism. So it requires more calories, in other words, to keep muscle. And so over time, when we're losing weight, we're trying to lose fat selectively and maintain muscle mass. And so when we replace hormones, it really does significantly help with maintenance of that lean muscle mass while we're losing weight. So you selectively lose fat better. And so what we find with our patients is not only they're feeling better, they have more drive and motivation, they're better, really, frankly, much better able to execute the game plan, so to speak. And their body physiologically is better to take this on